Well, hello everyone, and thank you for tuning in to SimplePractice's Ask the Expert webinar, Working with Autistic Children. My name is Mike, and we're excited to have you here today. Looking forward to introducing all the panelists. So a little background about myself. My background is in pediatric occupational therapy, and I've been working in sensory integration clinics and with startup clinics working with the autism community and their families, providing education and empowerment just as they help their child navigate their journey through life, through school, and through home, and setting them up for success. But let's keep going. I'd be happy to introduce the other panelist. Let's see. Next, I would like to introduce Dr. Joel Shorts. So, Dr. Shorts, if you would like to take a moment, introduce yourself. We're happy to have you today.
Hi, welcome. I love to be here. I'm a clinical psychologist in San Luis Obispo, California. I run with my wife Total Spectrum Counseling, which is a neurodiversity affirmative therapy and testing service. All of our employees are neurodivergent. And I also run Schwartz Neurodiversity Services, which will soon become Neurodiversity Affirmative Practice International, which will focus on educating professionals of all sorts to be neurodiversity affirmative and work with neurodivergent folks in an affirmative way to enhance their lives and accept who they are.
That sounds, we appreciate you being here, Dr. Schwartz. Thank you so much. Next, I would like to introduce Rachel Dorsey. Rachel, the floor is yours.
Thank you for having me. My name is Rachel Dorsey. I am autistic, and I'm also a speech-language pathologist. I have worked for the past 5.5 years as a speech pathologist with early childhood, school age, adolescents, post-secondary populations, primarily focusing on the autistic population or ADHD population too. I have a consultancy that is now, as of beginning of this month, turned it a full-time consultancy / private practice, so seeing clients through it too. And I'm also a course creator. My course, Goal Writing for Autistic Students, which aims at taking a neurodiversity affirming kind of lens into goal writing, particularly in the schools. It actually today found out that it got approval, or it got registration for ASHA and AOTA CEUs starting September 30th. So that's been a really big event today.
Rachel, that's awesome. You're going to have to keep us posted. As an OT myself, I would love to check that out, and I have a lot of colleagues that I'm sure as well. But thank you so much for your intro, Rachel. Happy to have you here. And next, I would like to introduce Amy Pillar. Amy, please, the floor is yours.
Hello, I'm Amy Pillar. I'm a pediatric occupational therapist. I own and operate Pillar Child Development, which is a pediatric therapy company with a few locations in the greater Phoenix area. My specialty of practice is in sensory integration, and I've done my research. My doctoral research was in the sensory environment, and still do some practice-based research today in the areas of sensory processing and sensory integration. So happy to be here today.
Awesome. We've got an excellent panel. I know we've got some excellent questions, and again, just very excited and thankful for everyone to be here. And let's dive in. So this first question, and would love to just kind of give a little caveat before this. We as panelists kind of prior to this had a good discussion about the naming of this webinar, this Ask the Expert webinar. Are we taking the person first approach, which is still kind of taught in academic programs and is still taught? I know it was taught in my OT program. I have some colleagues who are speech therapists and say that is taught. Are we taking the identity first? And again, I'm extremely grateful for the speakers here because all of you had such great insights. But with that being said, I would love to open this topic to everyone on the panel, and we can just start. Could we talk about the differences between person first and identity first in relation to autism? For example, working with children with autism versus working with autistic children. So let's give this one to Rachel to start, and after Rachel, just love to continue through the panel. Let's get everyone's insight.
Yeah, so I introduced myself as an autistic person or autistic speech language pathologist. I do that. I default to identity first language when talking to autistic people, or even talking to the parents of autistic children, because the autism is part of their identity, is part of the child's and the person's identity. I also feel like the sorry, I'm losing my words a little bit. The Joel, can you take over? Sorry, I'm losing my words a little bit.
Yeah, no problem.
No worries. No worries at all, Rachel.
So the way I see it is the idea of saying somebody with autism comes from this idea that autism is something pathological, something negative to be separated from the whole person. But the fact is autism affects how somebody senses, how they perceive, how they make meaning, how they are in the world, their relationships. And you can't take that away from somebody without taking away the core of who they are. And of course, autism isn't everything that somebody is, but it's certainly a really important part. And when we talk about really affirming and accepting autistic people, we can't separate it. We have to accept them and the autism. And so to dangle it out here like it's something yuck that I don't want part of myself isn't affirming to somebody who's autistic. So, the vast majority of autistic adults and autistic advocates, people in the advocacy community, have made the switch to using identity first language to really reinforce that we're accepting this as part of somebody instead of separating it from them.
Okay, thank you. And sorry to piggyback off of that. Sorry, I'm back, and I want to piggyback back on off of that into that. While I default to identity first language and agree that it should not be separated from the person, and I understand where parents can sometimes be coming from when they correct us as clinicians, like, oh no, it's my child isn't autistic, a child just has autism, or they were diagnosed with autism. I think it's really important that we as clinicians have power to we can respect the parent's view, but then through continued rapport building and continued discussion of autism in really neurodiversity affirming ways, we could shift how the parent sees their child, and thus sees autism, and thus makes the shift into using identity first language themselves. So they could start off in having one mindset, but I think it's our responsibility as professionals to see the parent where they're at, and then help them understand what is ultimately going to be the best for their child.
Very, very well said, Joel and Rachel. Really do appreciate those insights. And again, just love to get your opinion on this topic. And Amy, I would like to turn to you next and get your thoughts on this as well.
It's such a great conversation to have. And Rachel pointed out how important it is for us to be advocates for the clients that we see and to help. I always think of my clients are on a journey and their parents are on a journey too. And if I can help them on that journey to understand the beauty of their journey, which is maybe not what they initially intended for their lives, but how using the identity first language really, when I look at a child, all of the kids that I treat, but with our autistic children, that's a part of who they are. Just like Joel said, it makes them who they are. And so it's an important part to recognize and to value. And in addition, of course, as just a clinician myself, I always am going to default to, what do autistic adults, what have they told us that they prefer? And that's the language they've told us to prefer. I want to respect that as well. So.
Very well said. Very well said. And again, glad this question is asked and we can just discuss it from the get-go because I think it's a very important question and I appreciate everyone's insight with this. Let's go on to the next question too. Question number 2. And this question is, could each of the panelists recommend specific training or books to increase their competency working with autistic children? So I'm just going to follow around on my screen. So Amy, if you wouldn't mind taking this one and we'll keep working through.
Sure. I think there's so many great books out there, and I'll speak from the OT and probably more so the sensory perspective, which is such a key part of so many things we work on and that we help our autistic clients learn about themselves and how they can work through some of those areas that might be a barrier to the things they want to do. So it's hard to narrow it down, but of course I'm always a default to our classic sensory integration in the child, which is original work by Jean Ayers, who's the founder of sensory integration. Is just a really, really good overview of what sensory processing is and then how it impacts just the day-to-day life and different things that sometimes we take for granted or we might take for granted or think should just happen and how they happen. And so help us to understand that piece as well. And then to kind of, along with that, another great book is Sensational Kids, which is a Lucy Jane Miller book. And that also kind of brings it a little bit more to maybe parent-friendly language. So it's a great recommendation for parents.
That's, sensory integration in the child. That one's near and dear to my heart as well as my OT education. So great recommendation. Let's continue with Joel. I would love to get your take.
Sure. Now the thing to realize is almost everything you're going to find out there professional is written about autistic people through a neurotypical lens and pathologizes them and doesn't get it. So I would advise people to always default to actually autistic voices, and people who are championing actually autistic voices. So I want to look for books and panelists written by autistic people, books like Why I Jump.
The Reason I Jump. Yeah.
The Reason I Jump. Thank you. That's a great one. And as far as trainings go, you're not going to find much. So people like Rachel who are doing trainings, tuning my own horn. I do a training through Chicago School of Professional Psychology that is based on wholly autistic experience. I'm not autistic myself, but I champion their voices. So the majority, Zur actually has a pretty good training with Nick Walker, who's one of the forerunners of the autism advocacy movement. So that's a pretty good one. So anything that you see that's led by autistic voices is going to be a good go-to. Things that are not are typically going to give you a very skewed, inaccurate, ableist, and pathologizing view of what autism actually is.
Thank you, Joel. Rachel, I see you nodding in agreement to a lot of those things Joel said, but would love to get your insight and your take as well.
So as evidenced by the last question, I sometimes lose my words and I sometimes lose names of people. So I wrote down some names of people, majority of which are autistic, that have courses and a lot of materials that are fabulous, and they've definitely helped me in my own understanding of myself and how I work with autistic children. So I'll start with Oswin Latimer, who is with Foundation for Divergent Minds. They have a really great course on that I think is would be great for parents and professionals. They are autistic. Amy Laurent and actually I'm not sure how to pronounce their last name, Jacqueline Fade. They both run Autism Level Up, which has a lot of really great materials and occasional like webinars and Jacqueline is autistic. Who else? Christy Forbes is another name that specifically hones in on. She's autistic and has autistic children, so autistic mother of autistic children, and has training specifically on trauma-informed practice and the concept of pathological demand avoidance within the autistic population. Yeah, those people I would all recommend. To throw out two more names. They're not autistic, but in spite of that, I found their training, or I find their information to be so insightful. Kelly Maller is an occupational therapist that has an interoception training that I found to be a big game changer, and I find pairs really well with Autism Level Up's materials. And then also Kate McLaughlin is a speech language pathologist, an AAC specialist, and who really listens carefully to the AAC using community, to the non-speaking community. And I guess I would follow that up with, I know autistic voices need to be centered. I think we should all specifically try to learn from autistic people of color, autistic people that are in the LGBTQA community, and non-speaking autistics, because those are the people that are mostly marginalized. Their voices are least likely to make it to the forefront, to make it into an actual book. So we should be going above and beyond to listen to them specifically.
I wanted to throw in a couple more things that I missed really quickly. One is neuroclastic.com.
Yeah.
Yes. An amazing documentation of autistic experience and how to work with and connect with autistic people. And then another self-advertisement. I run a group called Neurodiversity Affirmative Therapists on Facebook, which is a great place to have these discussions. And we have many openly neurodivergent clinicians who talk about their experience, how they work with autistic people, etc.
Thank you so much for those recommendations. Those were extremely helpful. And yeah, I'm sure our viewers we've got a lot of great resources to kind of pull from and learn from. So truly appreciate those recommendations. This next question, I'd like to ask kind of Rachel and Joel on. So what are your best neurodiversity affirming practices for autistic people? So let's start with Rachel on this one.
So this question, my best neurodiversity affirming practices. I mean, my neurodiversity, but I think that calls to that we need to answer, well, what is neurodiversity affirming practice? I don't necessarily think they have a ranking. Maybe I'm looking into the word best too much. But neurodiversity affirming practice, or at least the way I practice, is by presuming competence in autistic children. So, or autistic people, that they have the ability to learn to learn. There aren't prerequisites to communication. They don't have to prove anything to me in terms of their cognition or linguistically or motor wise or anything in order to be able to communicate. It's up to me as a clinician to figure out what, in terms of like an AAC, so augmentative alternative communication advice, what would be the best fit for that autistic person. I don't consent and dissent are huge things that very early on I prioritize, because all too often autistic people in a lot of traditional practices just kind of have to do the thing. Does the thing have meaning? But they have to do it, and then they're physically manipulated. And so I include as part of my neurodiversity affirmative practices, respecting dissent, teaching more different types of dissent, and also educating the family on what I'm doing, why I'm doing it, and why it is better off in the long term for their autistic loved ones, as opposed to some practices that are more traditional or mainstream. Okay.
Thank you so much, Rachel. And Joel, would love to get your take as well.
Sure. Even though I'm a psychologist and not a OT, when working with autistic people, you always want to attend to their sensory environment first. And so, and I mean, this is probably true of all people really, but the sensitivities of the autistic population are such where if they're being bombarded by uncomfortable sounds, uncomfortable sensations, there's no way you're going to have a therapeutic environment or a learning environment. So one of the things that I do, no matter what age and no matter what neurotype, is I start with, is the light in here comfortable? Is the air in here comfortable? Are the smells in here comfortable? And I have ways to manipulate all of those. I have, jars of essential oils that people can open and close at their ease. I don't put that in the whole room because I don't want to have my next client hate that smell. So I have them in jars that people can open up. We need to, and then it's how do you like to communicate? I don't force a type of communication. Do you want to text with me? Do you want to just play side by side? Do you want to talk face to face? Where do you want me in the room that's comfortable for you? And then also multiple ways to communicate, through drawing, through art, through music, whatever way that it works for them to communicate. And then the last one is, how do you like to move? So we don't have to sit here in a chair or sit here side by side. We can stand on the furniture. We can take a walk. We can go to the garden down the street if that's where you feel most comfortable. And I find that just allowing people to make those decisions is 3/4 of the way to rapport, maybe even 90% of the way to rapport. And once those things are articulated and attended to, that really shows that you respect their way of being in the world, and that creates trust, and it creates assent, and it creates connection, and then we can kind of go from there.
I think that was great, Joel. And I do want to ask really quick. I saw Amy's eyes light up when you mentioned OT and sensory. So, Amy, I would love to, if you would love anything to add or kind of your experience as an OT working with this population, providing sensory integration therapy, would love to get your thoughts on that.
Yeah, well, I so appreciate Joel bringing it up, because I think as the OT, it's sometimes I forget that not everyone thinks that way, right? So the sensory environment's always, and sensory processing is always at the forefront of my mind with the kids. And it's such a true statement that if there's sensory things in the environment that a person is having trouble processing, the rest of what you're trying to work on or do, or just even engage and have a relationship, is going to be harder. So, if I can help with that sensory processing piece, or change the sensory environment so that we both are able to process what's in that environment and process one another. Now we can engage with each other. Now we're at a state of regulation, whether, as Joel said, we're moving about, I'm feeling better in my own body. Now I can engage. Now I can communicate. Now I'm at a place where I'm not overwhelmed by sensory experiences that it's all I can think about. So now, once we can adapt that or change that, our clients can really thrive, and as we would as well. It's just can be such a bigger piece for an autistic child or person.
Yeah, I'll add
Well
that, a lot of people will come to me with their child or adult newly diagnosed, and, with the goal of changing something about the child or dealing with something autistic. And I often will refer out to OT and speech first. And I kind of say, the kid's main needs are being able to communicate for self-advocacy and to manage their sensory environment. If you can give them that plus acceptance, everything else is then I could come along if there's other stuff, if there's anxiety, PTSD, or, managing ableism, and internalized ableism is a big part of this as well. But I see my job as secondary to those other aspects, which are really primary needs of autistic people.
I appreciate everyone's insight, and I like, Joel, how you kind of combined them together. And I'm sure as it'll come up, how we can all work together. We're not saying that I love OT. We're not saying OT is the only way to go, though, with working with this population. There's a lot of different routes. We see other therapies that are extremely beneficial, other resources. So it's great to see how we can collaborate and say, you know what, I've kind of done my part as an OT. I would love to work on improving this child's speech, or work on helping them in some other areas. So great to hear how we can collaborate as well with this, which is awesome. Sorry about that. Let's go to question 4, and I would like to start with Amy on this one. So how do we help educate the public to better understand autism and advocate well for our clients? Amy, being that you own a practice, being that you have multiple locations, I would love to get your insight on this with the community and the population you work with.
Sure. Well, I think everything that we've discussed so far has been very much about valuing the individual person, valuing that person for who they are, and helping our parents learn how to relate to their children, and helping our children learn how to relate to themselves and to the others in their environment. And all of that is really key when I'm thinking about just educating the public as well. I mean, we have already discussed some things. I'm sure others will mention more about the importance of advocacy and self-advocacy for our clients. But there's so many things. I feel that when my clients come and they are respected, and we're trying to help find what's important to them and how they can thrive in their in who they are, and you'll see that our clients make progress towards the things they want to do, and they're able to access the things they want to access, and that speaks for itself. So for me, I always see my clients are the best advocate to the public, to say how many amazing things and what amazing people autistic children are, and how much they contribute to our world, and that they're part of our community, and it's just a wonderful thing. So I find that we see that even in my clinics, when the kids have gone back to their pediatrician, for their next year follow-up, and they're talking now, and they're, sitting down and following directions, and the pediatricians are saying that that's great. They're seeing that, and they're seeing what a wonderful thing that intervention does, kind of help our clients be able to do the things that they need to do in the world. So I find the clients are the best advocates to the public. So
thank you, Amy. And Jill, I would love to get your take on this.
Harkening back to leading with autistic voices. Almost everything you're going to find in the public, again, is going to be through neurotypical lenses, through non-autistic lenses, and they fundamentally misunderstand the autistic experience. Fundamentally, I could give you so many examples. I'll give you one really quickly. So, study came out, Yale, I think, a while back, that said brain scans show that autistic people process objects and people in the same part of the brain, whereas non-autistic people have different parts of the brain. Therefore, we think that's why autistic people treat people like objects, which is the neurotypical interpretation of that. And me, who actually works with autistic experience and knows the way autistic people think and talk, and they tell me their experience, it's actually the opposite. It's that autistic people tend to anthropomorphize objects and anthropomorphize nature and have these deep, deep, deep fulfilling relationships with their favorite things. And it's why you have somebody like Greta Thunberg, who feels the earth dying, and it's as important to her as if her best friend is dying. And so she's tearing her hair out saying, why don't people find this important? And so that's what we do. The neuroscience is there, but we can interpret it through a neurotypical lens or through an autistic lens, which gives us a more accurate idea of what autistic people are going through. So that's number one. Focusing on autistic voices. The second one is kind of along those lines, is, we need to stop focusing our interventions on making autistic people understand and behave neurotypicality. I think that can be part of it because they have to survive in a neurotypical world, but we also need to start changing our programming to the environment in general and saying, this is how you understand and work with autistic people, like what we're doing today. That their way is not wrong, it's just different. And if you learn how to connect with and understand and work with autistic people from their perspective, it enriches us all. And in me doing this, it's really opened up my eyes to a different way of experiencing, which is so much more amazing than where I was before. And so I would urge everybody to get into the autistic mindset and experience the world in this more holistic, fruitful, rich, complex, meaningful way.
Thank you, Joel. And Rachel.
Yeah, hearing everyone's responses to questions, it's interesting. I feel like we've all interpreted the question in similar but slightly different ways. And maybe because I'm autistic, I interpret it in a different way, but I'm going to answer according to my interpretation. So when I think of the public, I think about people that I encounter every day. Through work, so like parents, school members, clinic, colleagues, early intervention service coordinators, that sort of thing, and how to help those people who are members of a society, and the society overwhelmingly sees autism as a tragedy, but simultaneously a superpower somehow. And so how do we get through? How do we get them to understand autism and then therefore advocate well for clients? And so I've found that that going a very to me, I think of kind of the persuasion aspect of this, and to people that like really think autism is a disorder, autism is something to be eliminated, should be cured, how to get through to them. And I think when talking to parents or colleagues, community members who believe such things, to me it's most important that there is some sort of groundwork of similar ethical values, of wanting to help this, they probably are going to say, person with autism feel self-actualized or something like that. Starting there, and then if we can agree on that, then kind of slowly discussing more neurodiversity affirming practices, and then helping the other person reflect on what they currently do and why do they currently do it and what are the aims of how they currently do it. And if the other person at a fundamental level, their aim is for the autistic person to just be like everyone else in society and be neurotypical, it is very, very difficult to it's impossible. So from kind of a pragmatic look at this question, I see it like find people who they might appear to have very different values, but they might underneath it all share very similar values and just be heavily misinformed from society or neurotypical lens and training, and work with them slowly over time.
That's a beautiful, beautiful answer. I truly appreciate that, Rachel.
And I'd like to add really quickly.
Go
this
ahead.
is the beauty of neurodiversity acceptance and inclusion. Is I'm ADHD and I answer the question in this big, grandiose way, and Rachel is autistic and really breaks down the little pieces and gives you very specific ways to do this. And both of those ways of reading and answering are important, and they feed off of each other in this really beautiful way. And if you don't have those multiple ways of existing in the world, you don't get this rainbow of interesting ways to understand the world.
I appreciate you pointing that out, Joel. That's a great point. Well, this next question I'd like to kind of gear towards Rachel. So, Rachel, from the SLP's perspective, what should I be doing in therapy as an SLP to support neurodivergent clients? And how can I set goals differently from a traditional treatment plan? And I know this is something that you've talked about and focused on before, but we would love to get your insight.
Yeah. Oh goodness. Well, goals are something I've been thinking about a lot over the past year, creating a course. But in schooling, traditional speech therapy really focuses on, and honestly, I feel like a lot of fields, but this is specific to speech therapy, focuses on a big focus on evidence-based practice. Okay, I think we need to question, what is it really evidence-based if the thing that we're measuring, the outcome of success, is something that the neurotypical or likely neurotypical researchers want to see, or is it something that a autistic or the autistic community population finds valuable? So a lot of the interventions for the autistic population presently are focused on I mean, a big one is like neurotypical social skills. So having things like small talk, things like an equal answering and asking back and forth of questions that can kind of shift to a variety of light topics pretty easily. on on eye contact, which a lot of people are kind of moving away from, but that, it's still some people are focusing on that. So those things are focusing on things like that are called masking, and masking is it is hard to put into a very simple definition, but the act, like, in these examples, acting neurotypical, really at the expense of your own identity, to please others around you. So that I'm not talking about how to move away from that. I'm talking about the bad things. Okay, one more other bad thing. A lot of focus is on this misunderstanding that like speech and language milestones are like missing throughout autistic language development. And it's our job as speech therapists to like fill in these gaps. Like the scattered skill set is like wording that's commonly seen, and it's like mysterious. We don't understand it, but like the reason is that like we're taking an autistic person and we're lining them up against neurotypical child language development, and it doesn't line up that way. And so that's kind of what we're taught. We're kind of set up to just make the autistic person follow along to like a neurotypical trajectory to get to my main point at the very end, which is very consistent with autistic communication style. Okay, so how to do it differently. You need to know a lot more about the autistic experience, about autistic cognitive processing styles, on autistic language development, about apraxia of speech, of dyspraxia, of sensory integration modulation. You need to really have an understanding of quite a big variety of things to understand where the what the autistic client needs from you, the SLP, in helping their communication growth in whatever modality is or several modalities is fitting in the moment, because it could change depending on various situations. Yeah, so that was a pretty broad, long answer. If you want specifics, I do have a course that I created that outlines a lot of autistic traits in a non-deficit driven way, and then a series of 8 case studies. We're given materials to analyze, and then to set strengths-based goals that align with the neurodiversity paradigm. Yeah.
No, that was a great answer. I appreciate that, and yeah, thank you for that info, as well as where people could go if they would like case studies, more specific examples of that. So if we'll go to the next question here, and this one, for those of us from a behavioral background, how does occupational therapy and speech language pathologist fit into the care team while working with autistic children? And so, Amy, I would like to start with you on this one.
Yeah, sure. With as with any clients that we're working with, but especially with our autistic children, we have many, usually a pretty large team that we all work together, with, the individual being the most important part of that team. But we do work with, speech language pathologists and behavioral health, from a variety of different aspects, and parents and teachers and many physicians. So it's quite a diverse team that we all work together. And it's important for us when I look at interprofessional practice and thinking about that piece, each of us have our own areas of expertise and how much we can learn from each other while really understanding what our expertise is in the process of helping our kids reach their goals and be who they're made to be. So I love to work with all types of different professionals, but for us, I think from the OT standpoint, we provide a lot of great information on understanding sensory processing, how that impacts behaviors. To me, when it comes to sensory processing, I often explain it as it's an innate need. It's something that you have to have. It's like if I'm hungry, I have to eat. If I have a need for movement, I have to move. That's not something that I'm going to cognitively override to an extent. And so I like to work with other professionals to help them kind of understand that piece, and how if I can help get these sensory needs met, then the child is able to really interact and engage and thrive and do whatever maybe the teacher's asking that child to do, or whatever it may be. So that's a really big, for me, important piece in our role as OT. And then I also would probably be remiss if I didn't kind of mention, and Rachel did a nice job of talking about masking and camouflaging, sometimes as it's called. And I just am happy and excited to see that I think OTs have really been at the forefront of the strength-based approach to treatment and interventions. I mean, I've been an OT for many years, and I remember learning that in OT school, that it was really important to be strength-based, and that was many years ago. And I don't know that all professions have been on board with that. And in fact, we just came out with our new Choosing Wisely recommendations from AOTA, and it did really, there was one that specifically focused on we are not to be implementing interventions that are specifically designed to reduce or eliminate some of those quote unquote behaviors that we see, those restrictive and repetitive patterns, that is not approaching things as strength-based or as person-centered or as valuing the person. And so even though I think many times for us as OTs, that seems like, well, of course we wouldn't do that. It's now been stated. We can now say that to our other professional friends and colleagues and tell them why that's so important. So I think that was a nice thing that just recently came out from the head of our profession.
Awesome, Amy. And this has come up before, but again, as we go through this question, Rachel would love to get your insight next. Just the power of that team working with different clients is huge, and the power of incorporating occupational therapy, speech therapy, behavioral health. We can really do a lot of great things and really provide a lot of support and empowerment. So great to hear that. But yeah, Rachel would love to get your thoughts on this question as well.
I just want to clarify. So behavioral health, meaning like professionals who use like a cognitive behavioral therapy type of an approach towards behavior. Is that kind of what? Help me understand a little bit more, because I'm not extremely familiar. I mean, I've probably worked with those with a behavioral health background, but it just wasn't called that.
Yeah, no, I think you hit the nail on the head. So those coming from maybe a counseling, coming from a psychology background.
Okay.
And yeah.
Okay, yeah. So yeah, I mean, so many autistic people, so many autistic children are, I mean, when I think counseling and mental health, I think of all the trauma that autistic people have to don't have to, but kind of have to. They shouldn't have to, but they have to anyway. That endure from kind of the beginning of life, right? Like that's from the very beginning of life. Autistic people our sensory systems are assaulted. And so I think about the impact of trauma and anxiety, and so really finding mental health specialist who is informed on these components is huge, and I wish there were way more than there currently are, but I appreciate Joel for like going for that, like trying to educate more. I mean, working with a team for like occupational therapy, that's probably like the first referral I do if the child's not already in occupational therapy. Oftentimes, occupational therapy that is reported to me by the parents doesn't focus on or not, or doesn't have in the therapy plan a sensory component. So then I have to research and try to find someone in the area who is knowledgeable about sensory integration.
Adults too. And sorry to interrupt. I'll throw some really quickly
No, you're
and let you
good.
get back. For the OTs out there listening to this, we need more people who are niching in autistic adults because their sensory needs are just as necessary. And I can tell you that we are dying for these referrals for those of us who work with autistic adults. So if you're a OT, start niching and you will be successful.
Yeah, I want a neurodiversity affirmative occupational therapist for me. Like that would greatly benefit my life. I don't know any in my area. But yeah, so yeah, that was it.
No, thank you. And just want to give you a second, Amy, you did a great job before. I know you do work with adults as well. I know you work with children. I know you do work with adults. So kind of going off of Joel and Rachel's comment, if you had anything you'd like to add about working as an OT with adults, I'd love to hear it.
Yeah, it is such a needed area, and I don't work with a lot of adults, but I do work with some and have worked with some in the past, and part of it is that I think there's a lot of barriers to access OT services or that type of OT services for adults. So that's something we need to do a little bit better of as a profession of OTs, is advocating for that important service for our adults or any individual with sensory processing needs, no matter what their age is. So we need to work on that advocacy, but it's such a needed piece, especially, I mean, for some of our autistic adults that I've worked with, they maybe never had good sensory integration therapy or never had any interventions to address sensory needs. And so there's a lot of things that we can do as OTs to help that. And then sometimes it's just sensory needs change as you in the aging process, which is, you know, something we still need to do a lot more research on and learning about the lived experiences of that aging process and how that changes our sensory processing as well. So we have some work to do as OTs, but if you love sensory, don't feel limited just to pediatrics. Adults need that as well.
Always a good reminder. We'll head over to the next question. And so this one's kind of looking at telehealth, and would love to give everyone's thoughts on this. So how has telehealth affected each of your work? And if we could maybe initially specifically focus on SLP and OT and working with a child kind of through that telehealth model, maybe doing screen sharing, doing a virtual whiteboard through a computer, would love to get some insights there, but would love to hear your experience with this as well, Joel. But yeah, let's start with Rachel for this one.
Sure. Yeah. So it's tough, and not always. Having the like a parent coaching type of a model has switching to that for a lot of clients or relying a lot more heavily on that type of a model has been huge, just because the gosh, I mean, like as adults, we like neurotypical adults don't like looking just at a screen telling you to learn something for like a very extended period of time. And so when I think of an autistic child, I think or a autistic child possibly has there is an ADHD as well. I just think that the I don't expect. I'm not going to, in the middle of a pandemic, really push for an autistic child, really of any age, to sit in front of a computer with me and just like do stuff. Like that's making it worse. That's not what they need right now. So I would say telehealth has, to again put my main point at the very end, telehealth has really shifted my work towards a parent coaching, helping the parent co-regulate with their child, helping the parent manage the trauma that is COVID-19. And honestly, like, while I want to be helping the child communicate, if they're in the middle of this trauma, of course it's going to be much harder for them to communicate. So I'm not a mental health specialist, but I really lead into the counseling skills that I have for telehealth.
No, thank you. And Amy, would love to get your perspective as an OT, and then after Amy and Joel would love to get your perspective as well.
Yeah, so telehealth is something that has been a journey for all of us, a learning curve, I guess. Something that has been great that we could continue to service our clients, and many times I think in our kind of forced us into, as a profession, and I think as therapists, into something that we were hesitant to do, and now we can tell you exactly what's good about it and what's not great about it. So in that aspect, I think that's been good. Rachel, said it so nicely that it has been a great opportunity to really, for our parents to work with them in that coaching model, and how much I think they have learned from what we do and why we do it, because we had to be suddenly very articulate with what we wanted rather than just doing it ourselves. And so our parents, I think, really learned a lot. And I learned a lot too. Our therapists learned a lot about how to work better with parents, how to explain things better to parents, the importance of working together, and how to facilitate that relationship. So that was a really good thing that came out of the telehealth. And Rachel also hit on that too. It's like we refocused. We had to refocus our goals. I mean, it was a different environment. Was that, maybe the goals that I had before were maybe not applicable, or they're not right for the environment that we're in. And so really having those conversations with the client as well as the parents as to what goals do we want for this time period, and what are our long-term goals after that, but what do we have right now, and with the challenges that we're facing at this point in time and the environment that we're in. And so that shift in goals, I think, was something that we did as practitioners, and really helped the success and the therapy to be beneficial, and for our clients to really still do what they wanted to do and help them reach the goals, even though those goals were probably different than they were before.
Thank you, Amy. Appreciate that insight. And Joel, would love to hear from you as well.
Sure. I think actually telehealth has been a huge boon for the counseling world when working with autistic people. Probably not. For the very young children, I don't work with the very young children. I work with maybe about like tween and above, maybe like 9, 10, 8, 9, 10. But if you start from a neurodiversity affirming perspective where you allow people to communicate how they want, share what they want, share in the way they want, there's a lot of options that telehealth and technology has done. So we can, share memes that express things, watch a favorite episode of their anime and talk about it. We can, if the person gets overwhelmed, they can turn off their camera and go to text instead of having to talk. They get to do it from the comfort of their own room. So that familiarity is there already and they don't have to deal with an uncomfortable sensory environment. So it does push on us to have to be creative in certain ways. And those who can be creative in those ways will find that telehealth and new technology can be a boon.
Yeah.
I really appreciate that insight.
I just wanted to say, I completely agree with the older clients that I do see, where parent education is important, the parent coaching might not be as relevant. I mean, honestly, with like all the teenagers I saw, like doing like online video games with each other, and like you said, like sharing memes or just doing text as opposed to speaking, I just wanted like that was excellent point that although it has its challenges because it is a collective trauma that we're going through, the computer does allow for all of these things, so much so that like when going back into clinic, I mean, I still have like my computer with me with clients, with older clients, and like and then we both watch like a 10-minute YouTube video on whales and something, or like to do like video games together or watch Mario or whatever together. So that was just an excellent point.
Yeah, in general, the gateway to connecting with autistic people is through their special interests. So any way that you can include that in the work that you do, no matter what that work is, you'll find connection and opening up and fun.
Oh, can I sorry, this doesn't relate it to this question, but I want to piggyback off of that point really, really fast.
Yeah, go ahead.
And say that, yes, the that through the special interests, connecting with autistic people is absolutely is the way to go to build that relationship. I think it's really important for clinicians, for professionals to have a it doesn't have to be a genuine interest also in the thing, but to demonstrate an appreciation of what the autistic person appreciates.
And authentic curiosity.
But like that's good wording. Authentic curiosity. I'm gonna script that for later. Authentic curiosity, because like as an autistic person, it is like I can tell when someone's just sort of letting me go off and like kind of just trying to like appease me and like let me talk, as opposed to like I don't really know much about it, and is it a huge passion of mine? No, but I appreciate that you love this thing so much, and I don't like seeing special interests being used as like a tool. They shouldn't be a tool. It's more of a of tool or kind of to me implies manipulation. But it should be something where there is a genuine bond, even if you the clinician don't have like a super strong interest in like Sonic the Hedgehog. It's a what was your phrasing, Joel?
Authentic curiosity.
Authentic curiosity, yes.
Yeah, there are certain modalities of therapies that will use that special interest connection as a way to then manipulate somebody to do their bidding or to interact in the way they want, and a real authentic connection and curiosity and honoring of the person will use that as a way to understand, connect, and not a manipulative way, but to genuinely connect and try to understand and figure out. And so, when I'm doing it, parts of the special interest become part of a shared vocabulary that we use in a way of understanding expressions. And I'll say like, oh, what episode of JoJo's Bizarre Adventure does that remind you of? And they'll be like, oh, this one. And let's watch it for a few seconds. And we'll talk about, the powers that we have, like the cartoon that help us get through life. And it becomes this way of authentically connecting and almost like inside jokes and a shared experience rather than manipulating them with pretending that we're friends now because, we like the same thing.
Thank you so much, everyone, for that insight. Well, we're going to start winding down our presentation. We have our last question here. Then after this, I am going to give some time for final thoughts and our closing. But for this question, how does a neurodiversity approach differ in younger, such as preschool or early school aged children versus older age, so teens or young adults? So let's go ahead. Joel, I'd love to get your thoughts on this one, and we'll just continue to work through.
I don't think it does. The only thing I think to throw in there is to throw out your ideas of what is mature and what isn't mature. You just accept people as they are, no matter what their age, and get into what they're into and allow them to explore who they are and how they move and how they feel and think. It doesn't matter what the age is.
Thank you. And Rachel?
Yeah, I mean, the only thing I can think. No, that's not even. Yeah, I was going to say that that with like a very, very young age, like being able to specifically communicate, like or self-advocate exactly what they want for themselves is often not there. But I mean, that could also there's also teenagers and young adults who it's our duty as clinicians, as well as for speech language pathologists, to help them, and they're non-speaking, to help them find a way to communicate exactly what they want to be working on. So anyway, the point I was going to say is actually not relevant, not true. And I don't think that there is a difference. Yeah.
Thank you. And Amy?
Well, both great comments. And of course it's that we're just meeting our clients where they are and who they are and wherever they may be. And maybe it's not so much age dependent, but just the needs of the client or just how they communicate. So my methodology may change, which may not be related to age. But for example, Rachel mentioned, a non-speaking person, no matter what the age, I might have to be a little more keenly observant than if someone was using words to communicate with me. But those are things that, we are always just finding what that person enjoys, what they value, what's important to them, and meeting that person where they are, regardless of their age. It just, I think, looks different because we have different interests and different things that we do as a 2-year-old versus a 16-year-old. So,
thank you. Well, I want to just take a moment, thank everyone for such a great conversation today. I've truly enjoyed everyone getting your insight and this dialogue, and I hope all the viewers have gotten something really important and meaningful out of this too, whether it was education, whether it was what steps to take next, or areas to further look into. But with that being said, I would love to end kind of with some final and closing thoughts here before we wrap up for the day. So Amy, again, I'll just work down the list. Amy, if you don't mind going ahead, just any final thoughts you have, now's the time.
Yeah, well, just thank you for inviting me to the panel. And I just, from the occupational therapy perspective, we have such a great, unique view of just how we view the world and how we work with clients. And we have a unique understanding of how sensory and motor and cognitive and social and emotional all interact together. And it's important for all of the clients that we see, and certainly very, very important in our role in the team of working with autistic children. So value what you do as OT. You have a very unique lens and a very keen and innate ability to value the person for who they are.
Very well said. Very well said. And Rachel.
Yeah, I guess to thank you. So I guess to also tie it back to profession specific. I would really like speech language pathologists to move. I mean, I know I mentioned this earlier as being a result of our education, but to move away from neurotypical milestones, kind of in language and like speech sound production and social skills, and to study what autistic culture is and how autistic people demonstrate things like joint attention and how they acquire language, often in a very different process, and how autistic social connection looks, and to also I want to say this one more time, to listen to the non-speaking AAC community. I kind of hate that in the last question I mentioned like young children and then like non-speaking AAC in the same type of sentence, even though regarding the question that was kind of relevant to the question. But non-speaking AAC users are non-speaking autistic people that are adults or teenagers, or are adults and teenagers, and shouldn't be spoken to like they're not there, like infants, like they don't have knowledge, and even and people that have intellectual disabilities that are also autistic similarly should be spoken to respectfully, have the ability to consent and dissent, to self-advocate, to communicate functionally, to socialize in a way that's meaningful to them. So I'm just kind of tagging in all my like ethical things here at the end, but yeah, what I want to say.
Yeah.
No, that's some great insight and always good reminders. And for you, Joel.
So piggybacking off of that, two big concepts to be aware of. One is camouflaging masking, which is the same concept, just two different words, which is essentially autistic people learning to fit in by masking and acting neurotypical, and the research is clear. This creates depression, anxiety, and suicidality, and disconnection. And the second one, ableism, like racism, is the idea that somebody is less than because of being different, having a disability. And just like, especially in America, if you've the systems of America, the education of America, we're all swimming in racism, and it's a lifelong process to undo the racism. It's exactly the same with ableism. It's different, of course. Ableism and racism have different consequences, but we're also swimming in ableism. And it's a lifelong process to undo the ableism. And so much of the researched interventions are focused on these short-term masking goals that in the long term are extremely harmful for autistic people. And so I'd really urge people to get an education on the social model of disability, on ableism. If you're working with autistic people, right after this, go to neuroqueer.com and read the foundational essays of neurodiversity and neurotypical privilege and autistic ways of thought that Nick Walker has written about. Take the trainings, and look at your own goals and the way you work with autistic people, and break down how much of what am I doing is about having them fit in and mask and be something different versus self-advocacy, self-expression in an authentic way, connection in an authentic way, even if I, as a non-autistic therapist, don't quite understand it. So I would say do that work. It's really hard work, but it's essential work if you're going to be working with any disability population.
Thank you so much, everyone, for your insight. This has been absolutely wonderful discussion. And again, would like to thank you all being here. On behalf of myself, Mike Jankowski, a pediatric occupational therapist in SimplePractice, we would love to thank again our speakers, Rachel Dorsey, Amy Pillar, and Dr. Joel Schwartz. Thank you so much for coming in and sharing your expertise, your experience. It's been extremely valuable. And for all the viewers as well, thank you for your time as well. This has been an excellent Ask the Expert, and thank you guys so much. And we'll be talking soon. See everyone later.
Thank you, SimplePractice, for doing this. This is important.